One of my favorite questions is a sternotomy needed for a thyroid goiter to be removed? And the answer is definitely not. Classically, this is the way I was trained. Certainly in residency, this was the thought process that large goiters down in the chest needed the bone or the breastbone to be cut in order to provide access. And I can tell you wholeheartedly, this is absolutely not true. What you do need is most of the time you can access the thyroid from the neck and pull it up out without having to go into the chest itself. I've done very large goiters that have been touching the heart and all removed transcervical through the neck, pulled up through. I have had cases where we've had patients with ectopic goiters, so thyroid goiters that are separate from the thyroid gland, which are growing in the chest itself. Just about 6 months ago, I had a patient who came to us, had a very large goiter sitting in front of his heart. It was huge. He had been to some other institutions where they told him that he would need a sternotomy. This is where I think they're wrong. I work with a very skilled CT surgeon, that's a cardiothoracic surgeon. We were able to go in with cameras between the ribs here and push the gland up through the neck so that we could do all of the surgery through here with just little tiny cuts inside the ribs. Now, this changes the recovery dramatically. Previously, to get a sternotomy, you'd have to cut through the breastbone and suture it together with large wires. Think open heart surgery. Very different now. These little cameras, he was out of the hospital in 2 days. No sternotomy, back to full function. This is definitely the way of the future for thyroid goiters. There's no reason to do sternotomies anymore. And if anyone's telling you otherwise, fly to New Jersey and I'll prove to you otherwise.